Hi everyone, I'm Dr. Faisel Sayed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Today, I'm talking to Dr. Robert Carlin, ChenMed's National Director of Vascular and General Surgery, about collaborative medicine for the future. Let's dive right in. I'm here with Dr. Rob Carlin today. I know that we're all thinking about Dr. Sayed, who has had a baby, and he is enjoying some time with his baby and the paternity leave that ChenMed affords him with. Rob, it's great to be here with you today, and we're generally talking. Our audience has students and residents and people interested in primary care. And I know you're a vascular surgeon, so we usually ask people to tell us about what brought you to medicine and then what brought you to ChenMed.
Well, hi, Dan. Nice to be talking with you as well. I know we're several hundred miles apart, but let's see. So medicine, I've always, first of all, my father's an oral surgeon. So growing up, although not an MD, he was a hardworking oral surgeon, kind of, I guess I would say old school, which I think we could appreciate, both of us can appreciate that when we talk about handling patient care issues. I remember growing up, we'd be taking trips in upstate New York, which is where I grew up, really, in kind of rural upstate. We'd be anywhere we went back before there were cell phones, obviously. He would always have a bag of quarters or dimes, whatever it was at the time, and stop at payphones along the way and check in on his patients. So that was, it was exceedingly annoying. When we'd be going on fishing trips and so forth, we'd have to stop everywhere and just want to get to the river. But anyway, so I was exposed to that growing up, and early on, I had a passion for the outdoors. I'm a fishing fanatic, and I would just disappear fishing on my own when I wasn't with my dad. And I liked eating fish, and so I also like cleaning fish. And so I find myself, dissecting fish really at an early age, which I was fascinated by. I'd open up the stomachs and see what they're eating and so forth, and then I eat the trout. But so anyway, at an early age, I was interested in anatomy, I guess you said, really looking at the anatomy of the fish inside and out. And so I knew I wanted to do something with my hands, and I liked science. As a fishing nut, I didn't really know if I was going to go into medicine. I seriously thought about going into oceanography, and almost ended up going to Woods Hole, just because I love the ocean and so forth. So it was kind of a crossroads at that point after I was in college, but I thought medicine would better adapt me for going fishing. It would allow me to go fishing when I wanted to, and I'd be able to interact with people, which is what I liked as well. So.
Well, and that, I mean, that's great. And I think we all learn. My mom was an operating room nurse, so
Oh, wow.
I got to watch her interact with the people in the small community I grew up in. And I remember her when she was on call, she would have to, if we were going to go out to eat somewhere, she would have to call the hospital and tell them where she was going to be so they could call her. I mean,
That's pretty funny.
we don't realize how nice we have it with cell phones now. And it was a big deal when she got a pager the first time so that she didn't have to call all the time. But so, you like to talk with people and you like to work with your hands. And obviously, I mean, you're a very, very highly skilled vascular surgeon, and you're pretty young to not be operating as much now. And so what about the U.S. healthcare system made you think, I want to join a bunch of primary care doctors and see what I can do to help them make a difference?
That's a great question. It's a cautionary tale, maybe is the right word. I've been banging away in the trenches, as we say, for a while, quite a while. Yeah, I know I'm not 60 yet, but I'm closing in on it. And I guess technically I still am, probably in the golden years of what I could do operatively. But the truth is, I was part of an amazing group. And as vascular surgery groups go, we had a pretty large group. I was, and I say it was amazing until it wasn't. And we had some issues, and this hits home to my ultimate change, and that is I saw the change in our group, and we had an independent outpatient center that we developed in addition to our usual inpatient stuff, and it was a nice mom and pop shop, and then we partnered up with one of these big companies, as you probably know the name Fresenius, and I was in charge of that center, and it was a giant lesson in what happens when you corporatize medicine as well as procedures. So I was in charge of that endeavor. It went from a mom and pop shop to tracking metrics, specifically how many cases are we doing, and we need to do more cases. And so we went from, being just an amazing group, evidence-based medicine, et cetera, great outcomes, and we still were really good, but there were some cracks that formed, and our group really imploded because of that. And the long and short of it is I walked away at age 50 from my group. I just couldn't look at a few members the same way anymore, and including one of my mentors, who was a mentor since I was a resident, really. So for almost 30 years, I just couldn't believe what happened. So I walked away. Honestly, I told my wife, who's a pediatrician, I said, look, I can't do this anymore. We went through a 2-year debacle in my group. I walked away, had literally no plan. I was all set to leave medicine, truly was. And I ran into the director of the vascular surgery program, which was still kind of new in Syracuse at the academic center, which is where I went to school at SUNY Upstate, and just happened to run into her at our national meeting in San Diego when I was visiting my sister. And Vivian didn't know what was happening, and really we were the only two groups in town. And I told her I was done, and she said, "Well, geez, would you consider coming over across town?" I said, "Okay." So I ended up my career in academics, which was fun, interacting with medical students and so forth. But I know it's a long-winded answer of how I got there, but I was ready for something different. I saw what was really happening on the front lines, and vascular in particular is one of the surgical specialties, if not the main one, that's really abused and overused by not just vascular surgeons, but other specialties that have delved into it, as you probably know. So, yeah.
Well, and and I hear people sometimes say, not at ChenMed, but out in the larger world, well, doctors are ethically obligated to do the best for their patients, and I think we are. But incentives do matter, right? I mean, if you're getting paid to do procedures, there's going to be more procedures performed, especially when you let the business people get involved with it. Um, and the other thing that struck me of what you said is once you see something happening wrong, you can't really unsee it. And then you have to either figure out a way to live with it or figure out a way to make a change.
That's exactly right. I couldn't say it any better. For all your points you just made, it's true. It's either you assimilate, adapt, and accept it, and it's a slippery slope, And I'm sure you know this, Dan. But for those of us that do procedures, you can see people start convincing themselves that, I think this is the right reason I'm doing this. Maybe it's different than I used to. Maybe I've let the company XYZ who makes this new, mousetrap that I can fix, quasi fix someone with and cost $20,000. Maybe that is the right thing to do after all. Maybe I should do it on every patient I see. And it's as you know, it's how you present yourself to the patient and how you present the data. And as we know, we could Google just about any topic, no matter how ridiculous it seems, and try and justify it and find some article that's written by someone to back us up.
Right.
So
Right.
there's a lot of that goes on.
Right. Right.
Yeah.
So what has been your work like at ChenMed and working with our doctors? What are you what have been the pleasant surprises you might have seen here, and what do you see as we need to do to help the primary care physicians from this specialty standpoint?
Yeah. So it's, when I showed up, and I've been here 6 months, so I'm still what I consider brand new. I got here and had this big corner office near the parking lot, and then like, now what do I do? And the way I look at this, Dan, is, it's almost like we're a startup within this organization. And I think that's kind of what we've called ourselves in specialty care, and held together by bubblegum and chicken wire and so forth, with figuring out our what we call initiatives. And so it's been an amazing experience working with the primary care physicians, and that's something that I actually enjoy. And in private practice, although we had kind of a quasi-academic feel to it my whole career, it was always a very personal interaction with our referring physicians, and so I'm used to that. you.